Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Niemann-Pick disease. What is Niemann-Pick disease? Niemann-Pick disease refers to a group of rare inherited metabolic disorders that results from the body's inability to properly metabolize lipids, that is fats, leading to the accumulation of these substances in various organs and tissues. Various organs means it may be spleen, liver, brain, bone marrow, even the lungs. There are several types of Niemann-Pick disease, but the two most common forms are Niemann-Pick disease A, Niemann-Pick disease type B. Another more severe form is Niemann-Pick type C. So this is a metabolic disease. This is a genetic disease. And there will be excessive accumulation of lipids in our body. And some organ will be very enlarged, like spleen, may be enlarged up to 10 times the normal size. Okay. Now, because it is a genetic disease, we'll learn the genetics of type A and type B. Okay. Let's start. Gene involved SMPD1, sphingomyelin phosphodiesterase 1 gene. Inheritance pattern autosomal recessive. This means that an individual must inherit a mutated copy of the SMPD1 gene from both parents to develop the disease. Function of the gene. What is the function of the gene? The SMPD1 gene provides instruction for producing an enzyme called acid sphingomyelinase. This enzyme plays a crucial role in breaking down a lipid called sphingomyelin. Mutation in SMPD1 leads to a deficiency in acid sphingomyelinase, resulting in accumulation of sphingomyelin in various tissues. Okay, we got the genetics. Now let's start the Niemann-Pick disease type 1. What is the enzyme deficiency? This form is characterized by deficiency of the enzyme acid sphingomyelinase, we just learned, leading to the accumulation of sphingomyelin in cell. What are the symptoms? Typically, symptoms appear in early infancy. Okay, and may include an enlarged liver and spleen. So we'll get hepatosplenomegaly, failure to thrive, and developmental delay. Neurological symptoms such as will happen, okay, like that of the mental retardation and also motor defects, and other problem like cherry red spot in the eye. Eye has a nervous layer called retina. Retina has a spot, we call it the retina. Normal retina has the macula. Macula has a center that is called fovea centralis. So what happened in Niemann-Pick disease? About 1/3 patient, they have cherry red spot in the eye, in the macular area. Okay, corner around the fovea centralis. Okay, and there will be also seizure that may happen, and will also include the intellectual incapability, low IQ, and motor disturbances may also occur. Prognosis: the Niemann-Pick disease A is a rapidly progressive severe form of Niemann-Pick disease often leading to death in early childhood. Okay, we got the Niemann-Pick disease A. Let's go to Niemann-Pick disease B now. Niemann-Pick disease B, enzyme deficiency similar to Niemann-Pick disease A, but the deficiency of acid sphingomyelinase is less severe. Symptoms can manifest in childhood or later in life. Individual with Niemann-Pick disease type B may experience respiratory problem, and while the neurological involvement is less severe than that of the Niemann-Pick disease A. So in Niemann-Pick disease type B, neurological involvement is much less, and it may manifest in childhood or later in life. Okay. Prognosis: the course of Niemann-Pick disease is generally less severe than Niemann-Pick A disease, and the individuals may survive into adulthood. Okay, so type A is severe. We have another one that is called Niemann-Pick disease type C. Genetic basis is different from type A, type B. NPC or Niemann-Pick disease type C is caused by mutation in either of the Niemann-Pick NPC1, okay, Niemann-Pick disease C1 or Niemann-Pick disease C2 gene, leading to impaired cholesterol transport within the cell. Symptoms: Niemann-Pick C disease typically presents with progressive neurological deterioration, including problems with movement, coordination, and intellectual decline. Other symptoms may include hepatosplenomegaly, difficulty swallowing, and seizure. So it is severe condition. It is much lesser than that of the type A and B, but it is more lethal. Niemann-Pick disease C is a progressive disorder that can affect multiple organs. Age of onset and rate of progression can vary, but it is often leads to premature death. Okay, so this is the Niemann-Pick type C disease, NPC. We have mutation NPC1, NPC2. Histopathology of Niemann-Pick disease. Okay, this is a storage disorder. Our lysosome contain a lot of undigested substances. Okay, like the hepatocyte. Suppose this is a hepatocyte, and we have also Kupffer cells. Okay, hepatocytes have a foamy vacuolated appearance. This is vacuolated foamy appearance. Okay, due to deposition of lipids. So not only hepatocyte, also the Kupffer cell, that is the macrophagic cell of the liver. It is a part of reticuloendothelial system, macrophage system. Here it is the Kupffer cell that also contain that, like that of the hepatocytes, will get vacuolated appearance because of collection of the sphingomyelin. Okay, so this is the histopathology. You have the hepatocyte. We have also the Kupffer cells. Okay, so we'll get inside it the foamy appearance because the lysosomes of the cell cannot digest the sphingomyelin or the lipid substance. Okay, these are the two pictures you can remember better. cherry red spot on the macula. This is the cherry red spot. Here, ataxia, clumsiness, gait disturbance, cognitive deterioration, cerebellar or supranuclear atrophy. Okay, that happened. Our gyri will be depressed. The sulci will be widened because of the atrophy of the brain, because of brain neuron is damaged. So there will be constipation, failure to thrive, feeling difficulties, and there will be vomiting. Okay, brain is not usually involved in Niemann-Pick disease type B, but A and C, that both of them involve the brain severely. So this is a rare disorder of India. Here, Niemann-Pick disease fact sheet. Niemann-Pick disease can affect the brain, nerves, spleen, liver, bone marrow, and in severe cases, the lungs. Okay, we got that. Now, people with this condition experience symptoms related to progressive loss of function of nerves. Nerve does not work. The brain and other organ also not work. Niemann-Pick disease can occur at any age but mainly affects the children. Okay, we got that. We got here the spleen, liver, okay, lungs. Okay, diagnosis and treatment. Diagnosis, genetic testing, enzyme assess, and imaging studies can be used for diagnosis. Treatment, there is no cure for Niemann-Pick disease. Treatment is often focused on managing symptoms and providing supportive care. Research into potential therapies, including enzyme replacement and substrate reduction, is ongoing, but it is not established yet. Niemann-Pick disease is a complex group of disorder, and management requires multidisciplinary approach involving medical specialist, genetic counselor, and supportive care provider. Genetic counseling is crucial for families as Niemann-Pick disease is inherited as an autosomal recessive manner. Okay. And that's all about the Niemann-Pick disease. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Okay.